Hello everyone, welcome to the Module 6 portfolio assignment. In this portfolio assignment, we have been asked to study, to find out one case study and understand it about that case studies and come up with what they found out, how it worked, what other factors were involved, kind of go into detail and try to present some kind of business kind of presentation. So I have found out one study, and what I'm going to do here, I'm going to talk about the uh, background of the case study, how the stronger economy has helped to prove that whatever the case study was happening, how the healthcare has been improved by having a stronger economy, and then how additional coverage lead to new clinic to be started, and what other factors has play critical role in that, and by doing more partnership and improving the quality, how the healthcare quality overall has improved. There are good thing, bad thing, there is uncertain features which they found out in the study, and study do talk about how different collaboration came together for helping the community, and finally what lesson we have learned from this case study. So let's move to the next slide. So the background. So we're trying to study the Western Kentucky uh, Paducah profile, one of the small town and community in the Western Kentucky, and so the background of the area is that it's a hub of nation inland waterways, and this area has used art as an economic engine, and it has a national quilt museum of very good quality, and improving on the tracked indicators, like a lot of indicators where you can see that it's improved the health 17 over 32, and health system rank in 2012, if you see, it was ranked as 279 out of 306, but in 2016 you see they bumped up to 225. And you can see the demographic of the area, like how many percentage whites are there, black, like 88% are white, 7% black, 3% other non-Hispanic, and 3% is Hispanic. And average median income is for the area is around $44,171, and which is lower than nationally. uh, so these are the background for the area. Now let's move to the next slide. As I mentioned, the stronger economy. So it is an economic center for the agriculture, professional services, barge companies ferry goods up near Mississippi River, computer and information technologies company like a Computer Services Inc. So these are the economic engine for this area. And same time they have a lot of economic challenges also. There is a opioid epidemic is going on. The population is has obesity problem. Suicide rates are high. Many people are smoker numbers are high, and area has very high poverty rate also. So as you can see, there are some advantage in the economy and some disadvantages. Some challenges are there. So this is one of the chart I pull out of the case study. As you can see how the quintiles are ranking, how things are ranking overall access and affordability. If you look in 2012, it was 4, then it's got 5, it was 5 and then it's gone to 4. And similarly, as you can see, the ranks are improving. So different indicators has been provided here. You can see the HRRs in the US, how the numbers are improving over the time. So that's the stronger economy picture until the 2014. So what what this area tried to do, they tried to expand the Medicare, where by expanding the Medicare, they could add 500,000 adults to the program, where uninsured rates had fallen to the historic low, fallen to 7.8% for the age of 19 to 64. Medicare expansion galvanized effort to establish federally qualified healthcare centers where the access to health has become much easier because more and more people are insured right now. FQHC helped to reduce the shortage of primary care in the region. So more and more people have access to the healthcare because they are insured. So that insurance part, being insured part, has driving the growth into the opening a new clinic in the area. And as you can see, the mayor of Paducah, where she's just trying to take a picture in front of the newly opened healthcare, which is part of the Kentucky care system. So as you can see, expansion of Kentucky Care has started, and they're serving around 20,000 people, 20,000 patients, and 60% of whom covered under Medicaid, which is up by the percent compared to 2012. So, so as you can see, the growth and coverage is increasing in the area. Other factors. So as Lauders Hospital in Paducah, affiliated with the Mercy Health System, partnered with the Kentucky Care for 281 bed hospital. It's this hospital was set up to serve uninsured patients, those on Medicare, working poor who used emergency department as a primary care. And this helped area to reduce the or to improve the rate of vaccination, where most of the people are trying to be vaccinated for the flu and other vaccination, available vaccination, so they can be more healthy. So as you can see, rate is gone up by 30% compared to 33% in 2011 and 12. Healthcare quality improvement. So as the more and more people were using the healthcare, and the healthcare system is trying to improve the measurement of quality. They compare many criteria, and they have came up with good numbers and good flying color numbers. But now the sad part, where uh, uncertain future has taken place, where uh, the state got a new governor, and he's planning to scale down the program. And as per him, the program is financially unstable due to the state pension crisis, high poverty rate, low rate of labor force. So this program has uncertain future. So we don't know how long it's going to go, what's going to happen down the line. But that's one of the things was highlighted in the case study. And very important thing we found out in this case study, there was a lot of collaboration between the community and other foundations, where they came together and trying to promote the physical activity to reduce the obesity, addressing the social determinant of the health. And Rotary Club and the Foundation for a Health Kentucky to build a health park in low income neighborhood, playgrounds, outdoor gym, walking trails, community garden, which helps to improve the quality of the health. So with these things are in a place, even if governor tried to scale down the program, but still the basic infrastructures are in place. At least that is a good sign, where still the people in the neighborhood, people in the community can use this facility and improve their healthcare. Uh, what lesson we have learned here? Federal and state policy enable local community with a quick action to improve the access care. So as you can see, using Affordable Care Act money, where they're trying to expand the Medicare, they have taken that money and how they could use that money and improve the quality of the healthcare in the community. So that we have seen in this case study. And another strong point we have seen here, there is a strong social tie where different groups are coming together and trying to improve the healthcare of the community by providing the park or by encouraging them to use the park. So these two are lessons are very important we have seen in this case study. This is my references, and thank you for listening.